All right, well, it's 12 o'clock. We're going to go ahead and get started. Thanks everyone for joining us. Today is Tuesday. This is our second to last session. It's our ninth ECHO session of the third series of the pediatric PPCL ECHO. I'm Jody West and I'm the coordinator. I'll go over a few housekeeping. Please enter your information into the chat for attendance, as well as to get the recommendation slides and survey link to you post-session. This is our agenda today. We're going to do our best to stick with it. Dr. Olivier is going to lead us through some introductions. We're going to have the didactic presentation by Dr. Olivier. Dr. Cockey is going to present the case, and then we're going to have time to discuss any clarifying questions, recommendations, and wrap up with any announcements for our next session. So just a brief introduction of myself. I'm Jody West. I am the coordinator of the ECHO, but I'm the program manager for PPCL, which is the provider to provider consultation line. And we provide consultation for pediatric and perinatal mental health concerns. So if you scan that QR code, it brings you to our website. If you have only participated in our ECHO, I encourage you to look at our website to find out what other services PPCL provides. If not, that's fine. We're glad you're here. But we do the trainings to increase knowledge about pediatric, which is 0 to 21, as well as perinatal mental health issues or concerns that providers may have. So we're here to help you. We work directly with providers. I'm going to hand it over to Dr. Olivier to lead us through the rest of the introductions, please.
Hey, good afternoon, everybody, and thanks for joining us again. I'm going to reintroduce you guys to our hub team of experts. I'm Dr. Olivier. I'm the child and adolescent psychiatrist on the team. I'm located in Lafayette, Louisiana at Bloom Mental Wellness in my private practice. I am presenting the didactic today, along with Dr. Cockey presenting the case presentation. But I'm gonna call through some of the other hub team members and ask them to introduce themselves to y'all again, starting with Ashley Hutchins.
Hello, everybody. I'm Ashley Hutchins. I'm a psychiatric nurse practitioner here at Bloom Mental Wellness as well in Lafayette, Louisiana.
Thanks, Ashley. Dr. Queen.
Hi, I'm Dr. Katie Queen, and I'm general pediatrician. I live in Covington, Louisiana, and I practice in Louisiana and Baton Rouge for our ldh.la.gov health system, and I'm happy to be part of that system.
Hey, Dr. Queen, the microphone, you can't hear you. It's kind of muffled.
You can't read lip service. Huh? Okay.
It's very, very soft.
Okay, I am Dr. Queen. Do you hear me now?
That's better.
Okay. I wasn't angled the right way. So I'm a general pediatrician. I live in Covington, Louisiana, and I work for Our Lady of the Lake Children's Health, and I'm part of the hub team.
All right, thank you. And y'all met Jody. She is also our social worker on our expert team. And Lena, you want to introduce yourself too?
Sure. Hi, everybody. My name's Lena Riggett. I'm an LCSW and one of the mental health consultants for PPCL.
All right, thank you. We're going to roll right into the didactic presentation. Today, I'm talking about consent laws and minors in the state of Louisiana. This will be a refresher for some of you. Some of you are very familiar with the consent laws, and for others, this will be mind-blowing presentation. Every time I brush up on this topic, I do have these oh moments, because not everything with consent in Louisiana when it concerns adolescents and children is black and white. There are some overlap. There are some laws that kind of disagree with each other. But I do want y'all to leave here knowing you do have some protections as providers that provide care to minors. So next slide, please. So this talk has a twofold purpose. One, I want to review the Louisiana Children's Code and why that's important in our state. And then I'll go through some of the consent laws, specifically relating to different aspects of consent for minors. Next. Okay, so the definition, so state laws dictate what age individuals must be, how old they must be to get married, enter contracts, take out student loans, or make other legal decisions. Those under the age of majority or minors are considered incapable of making such decisions in the eyes of the law. And in the state of Louisiana, the age of majority is 18. So anyone ages 17 and under is considered a minor. When a minor reaches 18 in Louisiana, they are considered an adult thereafter. But there are specific laws that give consent for minors to make decisions on their behalf in certain situations, and that's what we're going to review today mostly. Next. So true or false question. All states have a children's code or similar. So the answer to this is false. There are only 34 states right now that actually have specific laws, a specific code as it relates to children. So I love talking about this topic because sometimes in these meetings, it's hard because we know Louisiana is an under-resourced state. And so this is one of the things that Louisiana has done right, is we actually have a children's code. So next slide, please. So what is the Louisiana's Children's Code? So back in the 1990s, the early 90s, in 1991 specifically, a group of lawyers, legal aides, and judges got together and they went through the Louisiana Constitution, and they pulled out all the articles and laws as they relate to minors, and they put them all together into one big children's code. It's huge. So we'll go through it. I don't know, can we screen share from the PowerPoint if I share my screen?
Jody, you're on mute.
Oh, yep.
I'm sharing you want me to click on the link? And
Oh
see?
yeah, can you click the link?
Let's see if it works. Did it work?
No.
No, you'll probably have to do a second screen share. Oh, there you go.
Okay. So this was just, okay, go back. Sorry, go back to the PowerPoint. There you go. Okay. And so next slide, please. That wasn't the link I was thinking of. Oh, there you go. Okay, so this was the actual law. This was the acts that were passed in 1991 that actually created the Children's Code. And click again. And so you can just see that they pulled all these different articles, and I'm talking thousands upon thousands of articles, and put together this children's code that was passed in 1991. Next slide. And so I'll briefly introduce you to it and how to access it, and kind of give you an overview of how it's organized. This is the link I'd like you to click, Jody. So it is all published online. It has a nice website. But if you can just scroll down, it's huge. It's over 1,700 articles, but it is generally divided into chapters that go by the 100. So chapter 100 is basically the legal jargon and the terminology used. And then it goes into chapter 200, chapter 300. And it basically covers, it's a lot of legal stuff and a lot of legal proceedings as they pertain to minors. But there's sections that relate to adoption and child custody. There's sections that relate to child abuse and reporting. There's sections that relate to mental capacity, to handling juvenile delinquency. And if you scroll down, the most important part for us as physicians and as mental health providers is the 1400 section. So if you scroll down, the 1,400 articles are all the rights when it comes to getting treatment for mental health for children in Louisiana. These are extensive, but it's very specific. And a lot of these articles dictate treatment in an inpatient facility as well. So juveniles have a lot of rights in inpatient facilities. And we'll go over some of those specifically because I find them important. So specifically, if you click on 1409, where it says rights guaranteed, you can see this is huge, but I want to point out to you a few of them. First of all, number 3, reasonable times and places for the use of telephones and for visits may be established in writing by the director. The director of a facility must allow patients at a minimum reasonable daily communication by telephone and visitation. So like, this is how specific some of these rights are, that children in inpatient facilities get daily telephone calls and daily visitation. Because you will see this as you see people come out of, as you see patients that come out of these facilities, they'll say, well, I only got to see my parents 3 days a week. They're violating the child's rights. I just want you to get an idea of how specific that these can be. If you scroll on down to the bottom, there's an Article P that's very pertinent for treating. There you go, P. So no medication shall be administered to a minor patient unless a written order of physician prescribes it in writing. The physician is responsible for all medications which he has ordered and which are administered to a minor patient. That's very pertinent to the state of Louisiana's treatment of minors too. And what you won't see in here is that a parent's consent is required. So a lot of the laws when treating minors in Louisiana, the responsibility falls to the treating provider. So if you deem a medication or treatment necessary, then you are liable for that treatment, but you don't necessarily have to have parental consent for that. But this is just a breakdown and just a kind of a general idea of what the Louisiana Children's Code is all about. Why is this important? At some point in my career, I was a director of an inpatient facility, and I had a CEO that said, you know, I want to go to visitation to 2 days a week. You know, let's do that because we don't have enough staff, or, you know, it's a pain to have to staff all these visitations. And I said, have you read the Children's Code in Louisiana? And he didn't even know. He didn't even know we had a Children's Code. He was from Kentucky, I think. And so I pulled it up, and he had his corporate lawyers review the Children's Code, and it specifically says children have a right to daily visitation in the state of Louisiana. And so we had to change our policy of the hospital to go along with the law. So that is, in a nutshell, the Louisiana Children's Code. We can go back to the PowerPoint. Next slide. And the next slide, because we went through that, you saw Article 1409. So now we'll go through some general consent laws, specifically as they relate to medical consent, mental health consent, substance use, sexual consent. We're not going to do educational consent in this talk. And then we'll talk about birth control and pregnancies towards the end. Next slide. So true or false? An 8-year-old can consent for their own medical treatment in the state of Louisiana. The answer is true. An 8-year-old can consent. Next slide. So this is the specific laws related to medical consent. And I want to review these real quickly individually because of any take-home point, this is the most important point for you. So consent to the provision of medical or surgical care or services by a hospital, or to the performance of medical or surgical care services by a physician licensed in the state, when executed by a minor who believes himself to be afflicted with an illness or disease, shall be valid and binding as if the minor had achieved his majority. So basically, I want you to know that in the state of Louisiana, we have no lower age of consent for medical treatment. If the minor believes they are sick and needs this treatment, and you agree that this child is sick and needs treatment, you can provide that treatment to them with their own consent. If you look at Part C, upon the advice and direction of a treating physician, or in the case of medical staff, any one of them, a physician or member of medical staff may, but shall not be obligated to, inform the spouse, parent, or guardian of any such minor as to the treatment given or needed, and such information may be given to or withheld from the spouse, parent, or guardian without the consent and over the express objection of the minor. So you cannot go wrong. You don't explicitly in the state of Louisiana have to get consent from the parent to treat a minor for a medical illness. You also do not have to divulge any part of the treatment to the parent. But we're going to talk about the limitations of this just talk in general about good practice too. That kind of trumps this. But this is the law. And so you see it with your own eyes that we have no lower age of consent for medical treatment in Louisiana. Next slide. Again, what about privacy? What is HIPAA? So this is a weird gray area in Louisiana law because minors technically don't have HIPAA. They don't have privacy. So you could technically tell their parent, anything you wanted to tell them, at risk of losing rapport, at risk that that minor could come back, you know, and come at you legally for divulging that, but they can't because you've seen for yourself. It's up to your discretion what you divulge to the parents or not. And then vice versa, it's up to you what you tell the parent or not. You're not required by law to tell them anything. So I just wanted you to know and understand that. Okay, next slide. Okay, another true or false. An 8-year-old can consent for their own mental health treatment in the state of Louisiana. This is a gray area one, actually. The technical answer would be true, but this is a gray area. Next slide. So specifically mental health treatment consent. Louisiana does not currently have a provision explicitly authorizing minors to consent for mental health services. So we say those mental health services are looped under the medical consent law. So if they can, we see treatment of mental health as a medical illness. So we include that under the medical consent law. But there is an exception that there are specific Louisiana laws that expressly allow for minors to consent to their own treatment for drug abuse. There are specific laws for that, but not explicitly for mental health. We include mental health under the medical consent. Next slide. Another true or false. My 14-year-old, and we're going to go into the next topic of sexual consent. My 14-year-old patient reports having consensual sex with her 17-year-old boyfriend. This is a reportable offense. In the state of Louisiana, this is true. This is against the law. So let's talk about sexual consent. I included a handout on the next couple of slides. In the back of the presentation, there is a link to print it's a PDF file. Next slide. This PDF file was created by Stacy LeBlanc. She's an attorney in New Orleans, and Stacy used to come lecture us when I was in fellowship there. But she created this brochure, and we used to hand it out to all the patients, all the teenage patients at Children's Hospital when they would come to the inpatient unit there, because it lays out all the teen sex laws and sexual consent laws in Louisiana, and it brings up specific situations. So for instance, if you look on the left, I'm 17 and a 12-year-old girl at my school keeps emailing sexually explicit photos of herself and friends. So the 17-year-old can be charged with possession of child pornography and could be sentenced up to 99 years in jail. And so the point is that the laws are actually pretty harsh and pretty explicit about sexual consent. So next slide. The next slide, this part of the brochure goes into specific more details about the charges that you can get. So, if a 13 and a 15-year-old are having even a consensual relationship, they're at risk of being of legal charges because it's illegal in the state of Louisiana. This slide, it also goes into photographs or videos, and it also has a little portion at the bottom left that talks about sexting and sexually explicit content, and what all that means. And so I really like this handout. I'm not going to go into all the particulars of it, but this is great to have on hand. It's great to have in your practice. So if you do have a teen coming in that's like, but what about this? You can pull this out and show them. The penalties are harsh. You can get up to 6 months to 25 years in jail for some of these things. So when you have time, just review it and familiarize yourself with it. Okay, next slide. Okay, another true or false. A 14-year-old patient requests birth control from their pediatrician. Under Louisiana law, this is perfectly legal without parents' consent. This is true. Next slide. Excuse me. So Louisiana law expressly allows, sorry, I have something in my throat. Here's laws that expressly allow for them to consent. Oh my goodness, I'm sorry. It's that sinus drip. Oh my goodness. They can consent for treatment of STDs and substance use explicitly. There's no law specific to the prescribing of contraceptives, but again, that one is also another one that's assumed to be under the medical consent because it is a medical treatment. It is a medical treatment. Absolutely. Thank you. All right. Next slide, please. Pregnancy consent. Obviously, a minor can get treatment for pregnancy that's under medical consent. There's also a law that explicitly allows the consent of a minor to pain control during labor and childbirth. They can consent to their own epidural, their own spinal anesthesia in those cases. However, the caveat to that is weird in Louisiana. If a minor wishes to have an abortion, they do have to have the consent of one parent. And if a minor wants to give up their child for adoption, they do have to have parental consent. Those are two very specifics. Okay, next slide. This is kind of the opening this up to discussion. So what are the limitations to these laws, and where do we run into this in our own practices? Even if I have a minor consenting to their own medical treatment, what if they have to get medication? And what if they're using their parents' insurance? So, we get into these sticky areas. Okay, you're asking for birth control, but you're going to have to get it. Either you're going to pay cash, which not a lot of minors have cash, or you're going to have it run under your parents' insurance. So your parents are going to know about it. So you run into these special situations that, yeah, you can consent for your own treatment, but you really need to get your parents' consent too, because your parents are going to have to consent to pay for the treatment or pay for the medication. Can a minor refuse treatment in the state of Louisiana? And you can always refuse treatment, but technically under law, if it's life-saving or medically necessary, they're not allowed to refuse treatment over their parents' wishes. So again, there's these gray areas that you run into with the law. And then can a parent refuse treatment for their child? That's another gray area, but if you're a physician and you deem it medically necessary or life-saving, then your opinion trumps the parental opinions. Parents can refuse, but you can still treat the child if you deem it medically necessary. Another area that I run into a lot of issues is divorce and shared custody. And so I put the next slide in there on purpose. Next slide. Just the second paragraph, under any circumstances, the consent of only one parent is necessary for medical decision making. So I think that's important to know. But again, this is a gray area because I just told you minors can consent for their own treatment in the state of Louisiana, but then you can have only one parent consenting. So what does this mean? So the way I read or interpret this part of the law is that it's maybe not in like medically necessary, like say for acne treatment. Yeah, it arguably medically necessary, but also arguably elective treatment. For those types of things, you would need at least one parent consenting for that. Next slide. I'm not going to cover social media because I do want to have, we're actually out of time, but next slide is my references. And then real quick, just for a minute, any questions? Another take-home point that I want to emphasize to you is to have your own policy when it comes to consent. Like, of course, I would treat a minor for mental health reasons, but it's my own personal practice policy that I'm going to at least include one parent on and get their consent on treatment, because they're going to need it to get, to cover visits, to cover, medications, to communicate with the schools and that sort of thing. And also it's important for you to know what your policy is. If your clinic has a policy, if your hospital has a policy, and what the pharmacy's policies are, because yes, the law reads that I don't have to get, if I was working in an inpatient facility, I don't have to get parental consent for medication, but my hospital policy says that I need to get at least one parent's consent for medication. So again, it's best to familiarize yourself with their own individual policies.
Looks like Emelina has her hand raised.
Yeah, so I have a question because I get a lot of probably 95% of my patients are Medicaid. And so I get a lot of parents who are coming in that want their child on birth control. And then the child does not want to be on birth control. Like they don't feel as if, they're not sexually active. They swear up and down that they're not sexually active. Like, I usually try to err on the side of the child. Am I doing that correctly, or how does that go as far as consent law?
You can't go wrong. Even if you err on the side with the parent cannot force that medication down that child, to take the medication. I think,
Well, a lot of mine are Depo or Nexplanon. So it's like, you know,
yeah, so this is one of those gray areas. Is it medically necessary? Is it life-saving?
right. No.
No, it's more of elective. So then you would err on the side with the minor,
Okay, that's what I've been doing, but I've been getting a lot of angry parents. But I just wanted to make sure that I was within the right.
You are. All right, we will hold the rest of the questions for the end because we're gonna go right into our case. Thanks for presenting that case. That's a good one. They're all good.
Suckered me into it again.
But we love when you present.
Yeah, thanks to both Dr. Cocky and Dr. Olivier for all of that information. We will be sending out a summary with recommendations as well as the survey link. I don't know if it's in the chat yet but we'll put it in the chat to click. Even if you don't need the CMEs or CEUs, if you could fill out the survey, that just helps us guide our program and make sure that we're providing what you need as attendees. Our next session and our last session for this cohort is going to be November 12th. We do need a case, so if you're willing to present a case that you have, please let us know. The topic's going to be behavior problems in children. Is it a psychiatric problem or something else, by Dr. Cody Roy. So we appreciate your time. We'll post the recording of the didactic as soon as we have it edited, and we'll stay on for just a few moments if anyone has any additional questions. But thank you again to Dr. Olivier and Dr. Cocky. And bye, everybody.